Okay, here I have the fourth and final podcast of the nursing leadership content. This podcast is going to focus on performance improvement, which is a process that involves quality improvement, quality assurance, risk management, and risk reduction. First, we'll talk about quality improvement, which is an ongoing process. It continually evolves. There's 4 components of it. Continual analysis, that's just more of the more demonstration of that ongoing process. It's product evaluation, it's error prevention, and it's also customer satisfaction. So quality improvement will address all of those 4 things. Quality improvement is shared by everybody, not just done or performed by leaders or managers. It involves all at the facility to implement change and improvements. But some of the processes involve assigning responsibility. You have to be sure to involve the right people. You have to delineate scope of practice accurately, adequately, and publicly so everybody knows who's doing what. You have to identify important care priorities, preferably as a group. You have to decide what's important. Establish evaluation process. How are you going to measure improvement? And then collect and organize data. What will you use to measure improvement? Then you're going to initiate evaluation to determine whether you did what you set out to do. You're going to take appropriate actions to improve care and figure out what action should be taken now as a result of the information and the data you've collected. Then you're going to assess effectiveness of the action. Is this action effective after all, or does it need more evaluation? Communicating results is important, especially to those involved, but to others as well who might be interested in the outcomes you've achieved. So we're going to have knowledge sharing there. And identify breakdowns in communication. Is everybody on board? And document client care and results of the interventions. How does this affect patient care and patient outcomes? Many times, quality improvement needs are determined by leaders and managers, but it's not always the case. Anyone can bring concerns forward, and it should be the job of everyone involved in a group to do so. And it requires assessing the area or the environment or the people involved. Concerns can be gathered from patients or families and staff. Often this happens when managers do what's called daily satisfaction rounds within their care areas. That helps them identify the needs of the people they're serving. And the side benefit of this is that it also improves patient satisfaction as patients feel heard and valued when they're asked, what could we improve upon and what do you think was effective? The Plan, Do, Study, Act, or PDSA tool helps put a plan in place to tackle a problem. It's helpful because it addresses 3 key questions. First, what change are we trying to accomplish? Second, how will the change be assessed to determine if there was any improvement? And then third, what change is needed that will improve results? There are lots of ways to display data and determine or demonstrate cause and effect of the change that's being studied. And one common way is to create a visual from a chart or a graph. Those are usually helpful in getting a point across to people that you're trying to convince. Also, those types of visuals are effective in achieving buy-in from other coworkers or other parties involved. So the PDSA usually provides a lot of data to try to demonstrate to others why the change should be implemented or why there should be some sort of action taken. When we're trying to achieve quality improvement or performance improvement, we're always trying to elevate the standard of care. Standards of care continue to evolve as a result of science and technology and research and quality improvement initiatives that we're talking about. On this slide, there's a list of available resources that you can refer to throughout your career to determine if basic standards of care are being met, or to assist you in the quality improvement process itself. So I'll just talk about a few of these briefly, but it might be helpful for you to keep these in a place that you can refer to them again. The American Nurses Association, or the ANA, provides collection of standards of nursing practice, and it's accessible to all nurses. The National Quality Forum works in a sort of a backwards way, in that it develops and compiles sets of conditions that shouldn't ever happen so that others may learn from them and try to avoid them. So these are the things we never want to see happen. And their goal is to enable national quality measures, and they can do this by looking at the bigger picture across the country. The Centers for Medicaid and Medicare, CMS, that's a driver of quality improvement through the power of reimbursement for services. And we've talked about that before when we talked about the Medicare and Medicaid content. Basically, they set the standard of quality by not reimbursing for low quality of care. They kind of draw a line. This would include such things as hospital-acquired infections. It is helpful to keep up with whatever their focus is so that you can be responsive or even ahead of the game. All institutions will be interested in reimbursement issues because money talks. So they really do exert quite a bit of power for driving quality improvement and raising that standard of care. The Agency for Healthcare Research and Quality is a clearinghouse of sorts of quality measures and quality tools. So if you're interested in improvement and you're not sure how to measure it or what data to collect, this would be a great resource for you. The Joint Commission, formerly known as the Joint Commission on Accreditation of Healthcare, or JCAHO, is responsible for accrediting hospitals and identifies them as safe institutions if they grant them accreditation. This creates national patient safety goals that are updated periodically. So it'd be good to know how your facility is working to achieve these goals or how they measure up. And these are also great questions to ask about in an interview. Because remember, in an interview, they're not just interviewing you, you are also interviewing them. And the Joint Commission will also track reports of sentinel events. These are things that the hospital is required to report to the Joint Commission if they receive accreditation. So this would be like falls or readmission into the hospital within a certain amount of time. Sentinel alerts are published as a result of the reporting, and this helps to identify trends in practice so that we can stay ahead of problems. The Institute of Safe Medical Practices and the Institute of Healthcare Improvement are listed here. You can explore those if you'd like. The Leapfrog group I'll mention is unique in that it provides data to purchasers and patients, or the consumer, so that they can make informed decisions on the care they receive. So patients have a greater choice in who they see and where they go for care. And you can go to this website and look up your provider or facility to see how they rank in terms of safety measures and other events or other unwanted elements of care. Also, they provide quality indices for safe practices and policies that are made public to other people and other facilities. So this can inform others of strategies and quality improvement that have been effective at that institution and help others learn from them and maybe even implement them in their own way. And finally, the National Committee on Quality Insurance. It's not listed on this slide, but it measures quality of the nation's managed care plans. So this is one that looks at insurance companies themselves and tries to hold them accountable for quality patient care. So here we'll discuss some tips for managing and improving quality, and for that entire process really. But it's important to think of quality management as a system. In other words, if something goes wrong or a problem occurs, it's usually the process, not the person, that needs improvement. And most problems that come up are not typically related to or isolated to one individual. It's a process problem. And using outcome measures to guide and improve is important. The thing to remember here is there is a benefit to messing up. And if we can use our mistakes, they can be valuable. And really, when you think about it, there won't be any improvement without the mistakes. We have to mess up to try to improve. We are always striving for perfection, but we should be tolerating some failure, and this will encourage innovation. We try and we fail, and we try and we fail, and we try and sometimes we succeed. So we do have to tolerate those failures in between the successes. Performance appraisals and incident reports are not used for discipline when we have good quality improvement. When it's used for discipline, this disrupts honesty. Problems are not shared if there's any punitive action, and people won't want to bring any problems forward for fear of any retribution. And then also in managing quality improvement, it's important to know that a caring attitude is the best prevention of problems, meaning saying sorry doesn't mean you're accepting blame. It just means you're displaying empathy, and in that way you're demonstrating caring. So we can sometimes reduce the problem by showing empathy and responding in an empathetic way when problems do occur. Quality assurance would be the process of maintaining quality improvement that's already been achieved. So it ensures that a standard that you've met is being maintained. Chart reviews is one of the best methods we have to survey the work that is being done. It helps determine if a standard of practice is being met or if the quality improvement strategy is taking hold even. Of course, this assumes that the work is being charted. But whenever a process change is first put into place and everybody's on board with it, they're usually very attentive to the change at first. But after a period of time, efforts may slack a little bit. I believe this is just a bit of human nature at work, but it is one of the reasons that quality assurance is necessary. All right, we've talked about developing a culture of safety in a few different ways by now, and hopefully this is giving you the impression of how important it is, but transparency is a must. Staff should know what errors should be reported and encourage near-miss reporting, and we need to maintain that open dialogue and encourage feedback. And we can use clients as a safety check when we have a culture of safety. Our clients, our patients themselves, and even their family members can be a part of the effort in reducing error. But you have to listen to their concerns, not brush them off, and we have to encourage their questions because we want them involved. So when your patient questions the pill that they were just given to take and says it's not the same color as the one yesterday, your duty right then and there is to determine why it's different. Address the question, answer the question. Perhaps the patient is trying to reduce error right there and maybe helping you out a little bit. So do address it especially when our patients or family members or clients in whatever capacity are pointing things out. But the blameless culture and the consistency across disciplines and setting expectations are all a part of that as well. Risk management involves managing the risk once a problem has occurred to try to minimize the damage or the effects of the problem. A risk manager is tasked with risk management as well as risk reduction, and the focus is always on client safety. Functions of risk management would be to identify and define circumstances of financial risk, of course. Got to protect that bottom line. And they're going to assess and determine frequency of occurrence or circumstances. So what that means is they can see the big picture. They have an overview of the entire hospital, or sometimes the hospital system even. They will investigate and intervene in events involved in these circumstances. They'll explore the problem at length and may even interview those involved to get more needed information. They're going to identify areas of potential risk and seek to improve care. So that's a part of risk reduction, and I'll talk more about that a little bit further on the next slide. And then they will also coordinate and support coworkers through legal matters such as depositions that may come as a result of a breach in care. And finally, they will participate in root cause analyses. This involves looking backwards from a problem to figure out how to prevent it in the future. So it's, again, going backwards to trying to find the actual cause of the problem. And finally, as a part of quality improvement, we have risk reduction. And the focus for that is changing behaviors, preventing the risk before it even happens or occurs, and improving client outcomes, of course. Hospitals are required by their accrediting agency to employ a risk reduction program. These programs are designed to identify potential failures or of a product or process before the problem occurs. It assesses the risk associated with those failure modes and identifies to identify and carry out measures to improve the product or the process. So they're looking at they're looking for potential problems, basically. There is one such program called the Failure Mode Effects and Criticality Analysis. And I'll also just mention that the Joint Commission requires hospitals to look at one high-risk, low-volume process every year and identify potential risks to avoid them in the future before a problem even occurs. Now let me back that up for a second. The high-risk, low-volume process would be the thing that we don't do very often, so we're not quite in practice with it. It's not an everyday occurrence. It's not something we see very often, and yet there's very high risk involved, high risk or high potential for harm or error. And so the hospitals are tasked with looking at one of those processes every year and try to see what they can do to create fail-safes or try to look at it from every angle and prevent the problem before it actually ever even happens. Okay, that is going to be the end of this leadership content.